Chlamydia is an extremely common sexually transmitted disease. It is a bacteria known as Chlamydia trachomatis, which is found in semen and vaginal fluid, and it affects men and women in different ways. Now, we need to know how people get chlamydia. Any sexually active person can be infected with chlamydia, and it can be transmitted during vaginal, anal, or oral sex. The greater number of sexual partners, the greater the risk of infection. Young women and teenagers are at higher risk due to their cervix, the opening to the uterus, not being fully matured, and so are more susceptible to infection. Babies are also at risk, as an infected mother can pass on the disease to her infant during childbirth. Gonorrhea is a sexually transmitted disease caused by the bacterium Neisseria gonorrhoeae. It infects the urine canal of both men and women, whilst also attacking the cervix, uterus, and fallopian tubes of women. This bacterium can also be found in the mouth, throat, eyes, and anus. Pubic lice, Phythrus pubis, are also known as crabs and Prediculosis pubic. Being 2 mm long, they are of a grey-brown colour, and they live by sucking the blood from the skin, preferring to live in coarse hair. To be correctly diagnosed with genital herpes, it's important to visit your local GP. Genital herpes has no definitive cure. Antiviral medicines are available from your GP and/or gum clinic. These medications can stop outbreaks from occurring during the medication period, and they also shorten the length of outbreaks. Aciclovir, famciclovir, and valacyclovir are antiviral medications specifically used for genital herpes. These are generally prescribed in tablet form. These medications work by stopping HSV multiplying. The course of the medication needs to be fully completed, as the virus will continue to multiply if you stop taking it. Diagnosis of HPV is an important step in maintaining a healthy sexual lifestyle. To be correctly diagnosed with HPV genital warts, it is important that you visit your local GP or sexual health gum clinic. During the diagnosis, you will be asked about your symptoms, your sexual history, and then an examination of the infection or likely areas of occurrence will take place. The diagnosis within women will include a Pap smear test. This is where a sample of cells is taken from the vaginal area and placed upon a microscopic slide. This sample is then examined for any abnormal or malignant changes that HPV might have created. If any abnormal changes have been found, more testing will be done to determine which kind of HPV is present. It may lead to a condition called cirrhosis, permanent scarring of the liver, or liver cancer, both of which cause severe illness and even death. Hepatitis B virus, HBV, is transmitted from person to person through blood or other body fluids. Syphilis is a sexually transmitted disease caused by a type of bacteria known as spirochete. It's extremely small and can live almost anywhere in the body. The spirochetes that cause syphilis can be passed from one person to another through direct contact with a syphilis sore during sexual intercourse, either vaginal, anal, or oral sex. AIDS is one of the most deadly diseases in human history, and it can be caused by the HIV virus. There are an estimated 42 million people living with HIV or AIDS worldwide, and more than 3 million people each year die from AIDS-related illnesses.
I'm Dr Olwen Williams. I'm a consultant in genitourinary medicine at Wrexham Mailer Hospital. I've been working in this profession now for over 20 years. One of the most important things we can do as life is respect our bodies. We're all aware that there's a lot of stigma and a lot of embarrassment around sex and sexually transmitted infections. But if we want healthy bodies, we've got to consider getting over those barriers. People working in sexual health clinics are used to dealing with that embarrassment. So respect your body. Access a sexual health service when you're concerned or worried about sexually transmitted infections, or even better, think about it when you've had a recent change of partner or starting a new relationship, because knowing that you don't have a sexually transmitted infection can leave you to have a lot less worries and a lot less anxieties on your future relationships and your future health.